Welcome to the UC San Diego Shiley-Marcos Alzheimer's Disease Research Center Brain Blast series. My name is James Brewer, and I'm the director of the UC San Diego Department of Neurosciences and the Shiley-Marcos Alzheimer's Disease Research Center. I'm a professor of neurology, a clinical neurologist, and a brain imaging researcher. I'm pleased to present to you our virtual Brain Blast series. Each of the talks included in the series have been created by Shiley-Marcos ADRC colleagues with expertise in brain aging research that focuses on prevention, detection, diagnosis, and treatment of Alzheimer's disease and related dementias. Each of the experts featured in the series studies a unique aspect of brain aging and has developed a brief overview of their current research to highlight the state-of-the-art work that's going on here at UCSD and our center. We hope you'll take advantage of this free resource to learn more about the advances in brain aging, the importance of research, and the multitude of opportunities to get involved and participate in research studies.
Hi everyone, I'm Dr. Raeanne Moore. I'm a clinical neuropsychologist and an associate professor of psychiatry here at UCSD. I'm going to be talking today about a virtual reality tool for measuring thinking skills. Alzheimer's disease impacts multiple areas of brain function, including thinking skills such as the ability to remember, balance, as well as sensory abilities, such as hearing loss. The brain and thinking changes with Alzheimer's disease start small, and they can be hard to detect in the early stages of the disease process. There's a need for improved screening tools to assess brain changes associated with early Alzheimer's disease in order to intervene early when our current treatment options are most effective. There's also a need for improved screening tools for early assessment, because if we can intervene early, that will give people the opportunity to maintain quality of life for as long as possible. So together with Emory University and other colleagues at the Georgia Tech Research Institute, we have developed a virtual reality tool to measure thinking skills and balance. This new and exciting tool we're hoping can detect early signs of thinking changes and balance problems in people before they progress to seriously impact daily life. If found to be a reliable way to measure thinking skills and balance, our virtual reality tool could move testing out of the clinic and into the waiting room. And we're hoping ultimately that this tool could be something that could be used in the home and that people could use it just as they used to check their blood pressure. You're just checking your thinking skills regularly using our virtual reality device. Ultimately, we're hoping this could eliminate many of the burdensome features that are associated with traditional cognitive testing, including long, burdensome assessment batteries, often upwards of 6 hours or so, the required space and trained staff, and the expense of having to conduct these traditional assessments. Our virtual reality testing involves sitting in a chair, so it's done completely seated. You'd wear a headset on your face and respond using a little handheld controller, as well as respond with different head movements. Our tool was designed to briefly and accurately measure memory, reaction time, and other thinking skills, as well as to measure non-postural balance. So that is, we found a way to actually measure balance based just on how you move your head, like this, back and forth, so that the balance test can be done while seated and doesn't pose a risk for falling. Our study is for 2 years in total, so if you agree to participate, we're hoping you commit to participate for 2 years. It involves 5 different study visits. These visits are 6 months apart and alternate between a full visit and then very brief visits. So you would start out with a full visit. That would include coming to our laboratory, taking our traditional paper and pencil-based cognitive tasks, taking our virtual reality measurement tool, having a medical interview and a blood draw. This would also involve going to the San Diego State University audiology lab for a standard hearing test. And then you would come back at 6 months for a very brief, less than an hour visit and just complete our virtual reality measurement tool at that time. At 12 months, you'd come back for a full visit again. And then at 18 months, just the virtual reality. And then at 24 months, the full visit one more time. We are flexible in terms of scheduling, and we can accommodate Saturday schedules if a Monday through Friday timeframe doesn't work for you. So what can we learn with virtual reality? Well, we're hoping that our tool will be a way to really measure thinking abilities that are similar to paper and pencil tests, and will be as accurate and reliable as our paper and pencil tests. So they could ultimately move testing out of the clinic and into the real world. We're also hoping it'll be a way to detect minor brain changes associated with early Alzheimer's disease, and that it will ultimately, hopefully, help people be able to identify changes in cognition and balance over time. So if you're interested in participating, we do have some inclusion criteria, which includes being fluent in English, age 60 years of age or older. You can be a current Alzheimer's Disease Research Center participant or a new participant to the center. Currently not diagnosed with Alzheimer's disease or an Alzheimer's disease related dementia. And we do have some other inclusion/exclusion criteria that we would screen for over the phone prior to your enrollment in the study. So thank you for your attention today, and we're really hoping you'll reach out and participate in research at the ADRC. Thank you.
We hope you've enjoyed this presentation from our UC San Diego Shiley-Marcos Alzheimer's Disease Research Center Virtual Brain Blast series. Please look for other presentations in this series and share them with your communities. We hope that you'll also consider participating in brain research studies. We always have new opportunities for participation and are actively seeking individuals 65 and older without memory disorders, as well as those with a diagnosis of mild cognitive impairment or Alzheimer's disease and related dementias, such as frontotemporal dementia, Lewy body dementia, and Parkinson's dementia, as well as others. We're also proud to have a bilingual, bicultural team who conduct studies, visits in Spanish. Your participation can make a real difference for future generations. Please click on the description below to complete the very brief survey about the presentation you just viewed. And for those who are interested and who live in San Diego, we'll be happy to contact you. Simply provide your contact information on the secure survey. Thanks for watching, and we'll see you next time.